So, what are the causes of bilateral hydronephrosis? It can either be congenital or it may be acquired. And in bilateral hydronephrosis, probably there will be anuria. So, the causes, firstly, congenitally we have posterior urethral valve, and urethral stricture. So the child is born with these defects. It is congenitally present. There's a stricture that is congenitally present, or there's a posterior urethral valve, which is a congenital abnormality. And acquired causes include, again, because urethral stricture may be acquired as well as congenital. And there is another cause of obstruction, ureteral obstruction, and that is BPH. So, to begin with, unilateral causes of hydronephrosis include extramural obstruction, intramural obstruction, and intraluminal. Extramural obstruction means that the cause of the obstruction is from somewhere outside the kidney itself, and like some tumor from outside, from the adjacent structures, may be obstructing the outlet, the ureter or the urine outlet, which causes extramural obstruction. And there may be retroperitoneal fibrosis. Causes of intramural obstruction, which means basically that this wall over here is the cause of the obstruction. There is something's wrong with this wall, and that may be, for example, a ureteral stricture. There's a stricture over here which is causing urine outlet obstruction. And then one thing, like shown in this diagram here, is the obstructed uteropelvic junction right here. So the pelvis is enlarged due to hydronephrosis, and the calyces are enlarged and dilated due to hydronephrosis. And the cause is obstructed ureteropelvis junction, right? And another intramural cause may be that there is carcinoma of the bladder, which will be present somewhere here, right? If that makes sense. So the bladder is cancerous, which causes urine outlet obstruction, or the ureter may be cancerous, right? And intraluminal causes will include an obstruction inside the lumen, which may be, for example, ureteral stones or sloughed papilla. It may come here and it may block this lumen, causing a urine outlet obstruction, which results in hydronephrosis. So causes of bilateral obstruction again include posterior urethral valve, urethral stricture, acquired urethral stricture, BPH. So, what are the clinical features? As you can guess, first thing is pain, which is specifically in the flank region. Secondly, the patient will feel a mass in the loin because of the dilated pelvis and the dilated calyces. So, mass in loin. And thirdly, due to urinary outlet obstruction, the patient will experience anuria. And this basically mostly happens in bilateral hydronephrosis or bilateral urinary outlet obstruction. So how will we diagnose? Diagnosis is mostly for diagnosis we have to know the cause, right? So we look at the causes and then we think of how do we find them. For example, if the cause of hydronephrosis is stones, how will we know there are stones? CT scan. And secondly, X-ray. Thirdly, IVU, because it shows dilation. An IVU will show dilation. IVU is the intravenous urethrogram, which basically takes images of this whole tract and shows dilation, abnormal dilation. So yeah, basically these three investigations will lead to diagnosis. So what is the treatment? First of all, we will treat the cause. And if the patient comes with anuria, it is a very disturbing situation and we have to do something right now. So it is an emergency. Right? So with bilateral hydronephrosis, we will firstly drain drain the what will we drain? We will drain the pelvis. I don't know what we will drain. We will drain just, okay. And this will be done by catheterization. Then that's it. That's how we will treat it. That's it. Because we're gonna obviously treat the cause later on, but if there's anuria, firstly we're just gonna drain whatever through catheterization. and then we will come on treating the cause. And unilateral ureter obstruction may be drained by retrograde catheterization of the ureter by JJ stent. Double J stent, or by percutaneous nephrostomy. Okay, so we see two things here. First of all, catheterization by double J stent and percutaneous nephrostomy. So yeah, that's two things. So basically the treatment is just one, which is treat the cause. Other than that, we're just gonna drain. We're just gonna release the pressure built up, and we're just gonna drain all the urine that has been collecting inside to a catheter. It may be, the cause may be unilateral hydronephrosis or bilateral. It doesn't matter. In both the cases we have to drain, and then after that we will treat the cause. So again, in unilateral obstruction, we will do retrograde catheterization by double J stent or percutaneous nephrostomy. And in bilateral hydronephrosis, we would drain by catheterization. This is it. So again, hydronephrosis is the unusual dilation of the renal pelvis and the calyces. The pelvis, this is a normal callus and this is a normal pelvis, right? But in hydronephrosis we have some kind of a dilated, this sort of a pelvis and calyces which are dilated due to the extensive amount of urine present. So the causes will be either the causes will be, they can either be, the causes can lead to either unilateral or bilateral obstruction. Causes of unilateral obstruction are threefold. They may be extramural, they may be intramural, or they may be intraluminal. So the extramural cause will be tumors of the adjacent structures and retroperitoneal fibrosis. Cause of intramural obstruction would be strictures or carcinoma of the bladder or ureter, or the obstruction of the ureteropelvic junction. And the cause of intraluminal obstruction would be stones or sloughed papilla. So bilateral obstruction may be congenital or acquired. Congenital obstruction would be posterior urethral valve, urethral stricture, and acquired include also urethral stricture and BPH. Clinical features would obviously include flank pain, mass, and aneurysm in case of bilateral obstruction. Diagnosis is through 3 investigations: CT scan, ultrasonography, IVU. And the treatment is that basically we treat the cause, and then In bilateral or in unilateral obstruction, we drain by catheterization. And in case of unilateral obstruction, we may also drain through percutaneous nephrostomy. Right, that's it.